I don't mean to look silly, but I'm going to put these back on.
Yes, do. I'm Dr. Lee. How do you do?
Not too bad, thank you.
Come in and have a seat.
Thank you.
Have a seat there, yeah.
I have a migraine.
Oh,
And I had it.
I'm so sorry to leave you in the waiting room.
That's all right. There were lots of children. They were very loud. It's okay. No, I have a migraine. I had one yesterday. They're rather new. I started having them about a month ago. And I think I've had 3 in 4 weeks now. And they're quite persistent. They seem to last the whole day and then some of the next day. But this one seems to have started in the middle of yesterday, and this morning I woke up with that was a metaphorical axe between my eyes.
And then when the headache comes on...
It's behind my eyes, and sometimes I get one back here and one back there as well, which feels like there's a burning feeling trying to come out of my skull, which is...
so awful, isn't it? They're awful things. Right, so what do you take for it?
Usually just paracetamol, but last night I took 2 cocodamol because I really needed to get some sleep and it hurt too much.
And did they help?
Well, they knocked me out like a light, so yeah, I think they helped.
Actually, I have to stop you talking while I'm doing this, sorry. Yeah, that's great. Have you got some more cocodamol at home? Or did you borrow someone else's?
I used some of my girlfriend's because the ones I had are for my back, so they're far too strong.
So what I want to do is give you something slightly different that works in a different way.
Okay.
If you know one's coming on right at the beginning of a migraine, if you take this tablet, with luck, it'll just stop the whole thing happening.
Oh, right, okay, cool.
It won't help with this one you've got on at the moment.
No,
but I imagine that'll tail off in the next few days. So, the important thing is to have these on you.
Yeah.
If this settles down, we don't need to see you. But if it keeps going, we need to get you back and start to talk more generally about long-term management.
Yeah, absolutely.
Is that all right?
Yeah, that's wonderful.
Right, you can put those back on.
Yeah, I think I'm going to. All right. Well, thank you very much.
Oh, well, you poor thing. It's a really rotten headache, that one. But
back home to bed for me.
Back home to bed, I hope within 2... Well, then maybe you'll have tomorrow off. Yeah, come and have a seat.
Oh, thank you very much. I fell down 3 weeks ago in the office. I tripped and I fell. So, yeah, I find it difficult to walk in. I limp a little bit. And I think it's a bit swollen.
This is yours?
This is mine,
treated yourself,
yes.
Have you? Let's get your foot up on here so I can have a good look. Did you fall off shoes or were you...
Yeah, I was in heels, as usual at work, and I tripped. And then I just fell flat. So this side here, this hurts. I touch it and it's painful.
OK, so if I just run my finger down there...
Yeah.
It's there.
Yeah.
Quite sore, isn't it?
Yeah. So,
can you put your toe up?
I can, but it's...
Yeah. Right. So the next thing, cruelly, I'm going to get you to stand up, see what you can do with that foot.
OK.
But specifically, can you go up?
Ouch!
So that's really sore there.
Yeah.
Were you able to walk on it straight away once you'd done it?
Yes.
So it started to get better and then it started... I'll just wash my hands. So I think it must be a bruised bone, really.
Okay.
I think it's obviously not broken.
Yeah.
Because you've got a lovely arch and you're moving your foot around and you're not jumping off the chair when I feel it.
No.
Almost certainly it's going to get better. And I say with these things 6 weeks, but I'd be pretty confident that that's nothing serious. Okay.
Thank you,
well,
Elizabeth Lee.
It's a pleasure. Pleasure. I hope that settles because I think it will.
Thank you very much. I want to wear my heels.
Yeah, you want to get
so I miss them. Thank you.
You're their very first patient, so that's terribly exciting, isn't it?
Oh, for whom? For me or for them?
I don't know. OK, so this is Cherry and James. Mr Jennings, come and grab your normal seat. So Cherry and James are both doing their A-levels and they both wanted to become doctors for some extraordinary reason.
Dear.
What do we need to talk about today?
I think I read somewhere that you do test for, what was it, thing down here.
Prostate?
Prostate.
Talk about prostate cancer blood tests, is that what you're talking about?
Yeah. You know, so over a certain age, they...
You've had this done before, actually, haven't you?
Many moons ago.
Let's just have a look. You've actually had this checked 3 times before.
Have I?
Yeah, in 2005, 2011 and 2015. And on each occasion, the blood test was fine. OK, so it is only 2 years since you've had it checked.
Well, I didn't realise it had been done this recently.
I've no objection to you having another one, OK, but before we do that, let me just talk about the limitations of the test, okay?
Right.
Because it is very heavily plugged in the media.
Yeah.
So what it's measuring is a chemical that's produced by the prostate gland, OK? And everybody has that chemical produced. It's just a question of the amount that's produced. So, you know, I'm producing it, you're producing it, James is producing it. Generally, young men don't produce very much of it. As we get older, we all tend to produce more and more of it.
Yeah.
And it will also go up if you develop prostate cancer. But so if you see someone who's got a slightly raised PSA level, you know, it's not immediately clear whether that's because they're developing prostate cancer or because it's just a naturally large prostate. Okay. So in that situation, we need to do further investigations. I mean, we would need to examine the prostate through the back passage.
No, I've had that done.
You've had it done before.
OK, well, I think you've set my mind at rest.
Okay.
Do you want me
So
to...
is that a yes or no? Do you want to have it done or not?
That's a no.
That's a no. OK. There is no right and wrong answer here, but I think having seen your previous results, I mean, it would be reasonable to check it again in 5 years' time, or if you develop any symptoms of concern, which is quite a hard thing to evaluate, but something like passing blood in your urine, passing blood when you ejaculate, those things we should check it.
OK.
OK?
Yeah.
There we go.
That wasn't painful, was it?
It wasn't too painful. No one got an examination. Good. OK. See you again.
Yeah, bye-bye.
Cheers then.
All the
Bye-bye.
best. Cheers.
Just write me notes up.
Hello, how are you?
Hello.
All right?
Yes, come on through. Not too bad.
I hope you can sort it out.
I hope so
I've got to
too.
work tomorrow.
Have you? All right. Okay.
Well, I want to work tomorrow, unless you
Okay.
give me a note.
Okay. Come on through. I'm Dr. Ahmed. What's troubling you?
My finger. It's
Okay.
just swelled up
Okay. And when did that happen?
this morning.
Okay. So it's
Nice.
red along here, obviously.
Yeah, but I've been working on a machine, like,
What
trigger.
work did you do?
Tree surgeon. So with chainsaws and all
okay.
that, so obviously it might have just rattled something. I
Yeah.
don't know, but it's loads of pus as well.
It might just ease itself, but we'll give you a course of antibiotics to sort that out.
This
Seeing
chair
it.
is just from there upwards, just hurting.
Okay, so if despite the antibiotics that
Yeah.
gets worse,
Yeah.
then come in, because sometimes we need to, what we call, release the pus out,
Yeah.
okay? But it looks ready to go, so we'll give you a course of antibiotics.
Can't you just squeeze the pus out?
Don't fiddle with it, just leave it.
It's doing my head in now. It's like hard not to fiddle with. I can't
fiddle with
clench
it.
my fist either.
And let's just attack with some antibiotics.
bad for you, no?
Sometimes they can make, these ones can upset the stomach a bit.
I can.
So we'll see how you go, okay?
Look how big it is to everyone.
Do you smoke at all?
No. Why? Because does it affect them?
No, it's just that sometimes too much nicotine impairs healing. So,
Oh, yeah,
you know, but
alright.
if you're fit and well, all right,
So, do you reckon I should work tomorrow or not?
you can cover it up and see how you go at work. But you
Alright.
could give it a go and see.
Yeah, that's fine.
There you go. That's all of that.
So take all this and
Yeah.
this, yeah?
Yes.
Thank you.
Take care, Jack.
Cheers.
Bye-bye.
Bye-bye.
So how have you been over the weekend then?
Oh, well,
What's happened?
I got to go there Thursday.
You've got the letter and everything now. Excellent. Okay, so
but I asked them, I said, have I got to stay in? He said, no.
no. Well, that's a bit surprising.
Well, I mean, I'm having toes off and then
Normally they keep you in. And you've been feeling all right over the weekend? You hadn't had a temperature or
I
anything?
did, I was sort of sweating.
Well, you're on antibiotics. So.
Yeah, oh
Right
yeah.
then, let's take your temperature. 36.8. Have you taken any paracetamol or anything this ibuprofen this morning?
This morning, yeah.
Right, let's have a look. What's going on? Move back.
I'm going up in the road.
Right then. Doesn't particularly smell, so that's good.
They don't what?
There's no like odour,
Oh,
strong
right.
odour.
What's that like now, Juel?
Not great, Mike.
Innit?
No, I don't like that. I'm gonna have to get the juicy doctor to have a look at you.
I know you worry about me, Julie.
I do worry, Michael.
There's not much I can do about it, Angel. So what are you going to do now with this?
Well, it all depends on what the doctor wants to do. Whether you know, your op's booked for Thursday. It's whether
Well,
we
they
just.
won't have me out there till Thursday now, love.
Yeah. Right. So we're just waiting on the doctor to come.
Okay. And who's I got to see? Doctor.
Your doctor,
Penny.
Ahmed.
Oh,
yeah,
she's coming, is she?
She's on today, so and she saw it last week. Come in, please. Hi.
Hello.
Sorry.
Hello, Angel.
That's right. How are you, Michael?
Not well, not too bad, my love.
Haven't missed any tablets?
No, every day.
This Thursday, isn't it? The
Yeah.
procedure.
1 o'clock,
I think it
1
needs to be
o'clock.
seen in today, really. Looking at it, it's got a lot worse.
Yeah.
All right, Michael. We'll sort you out, OK?
Well, we'll go stay here, have
Just for the time
We're
being.
just gonna our phone up vascular. And,
All right, that's cold.
Yes, I know. I've always got cold hands, warm heart.
Okay.
Let's give it a clean, get it dressed. Right, if you just bend up your knee, that's it. Just rest it there.
Oh, go to hospital. I don't want to go to hospital.
All right. It's for the best, get this foot sorted.
Quick, you.
I'm doing it. I'm getting there.
Got there.
Yes. There we go.
Is that it?
That is it. You're done. Just gonna get the shoe on.
Right.
Okay.
I better stay here and wait till you get that cold on. Because he might want me to go straight out there.
Yeah. Right. Hi, yeah, I'm practice nurse at Hornford Health Centre. I've got a patient named to the vascular team with me. He's diabetic, and I feel that he's due an amputation on Thursday of this week, but his foot's significantly deteriorated, so I think he might need reviewing today. Thank you ever so much. All right, cheers, bye.
Oh.
Well, he doesn't feel, because you don't sound septic,
No.
which, to be fair,
Wait till
you're not.
Thursday.
Wait to Thursday, but to
Yeah.
review it on a day-to-day basis,
Thing.
which we already are. But I just need to check, obviously, with Rita that she's happy with that.
Hello.
Hi, it's Julie about Michael. Hi, yeah.
So I've just spoken to the vascular on call, and he feels that he's not technically septic at the moment, but he said...
You know, obviously we're seeing him daily.
So if we safety net quite strongly with Michael.
Yeah.
Michael mentioned that he hasn't got enough flucloxacillin, has he?
And that's fine, I'll bring the prescription round. I will probably do a letter at this point.
Like you say, it isn't hot. He's not got temperature. But we're very close to getting
To that point.
Yeah, that's the worry, isn't it? But he seemed aware of that, and he was like, look, you know, you've seen him daily. Get hold of us if you need us. You know, don't hesitate.
Okay,
Well, thank you very much, Julie. I'll
Okay.
pop round with that. Thanks.
Thanks.
Take care.
Okay,
bye
bye.
for now.
Frida's going to come round with your antibiotics a minute.
Okay, now.
But the rest of your foot didn't feel off, if you know what I mean. The actual ulcer looked awful, but the rest
I
of
mean,
it...
I can't see the bottom. I mean, you can. I can't.
But it is the worst,
Oh, I
yeah.
love darling.
Michael, if you don't feel well, we need to see you. If we're shut and there's a temperature, you go straight to casualty.
Yeah.
But we'll be seeing you in the morning anyway.
Yes, you will,
And that's
yeah.
the prescription for the
I
antibiotics.
want
Yeah,
them
go
now,
and get it,
All right,
yeah.
my love. Thank you very much.
If you take that next door, they'll give you the tablets.
Okay, my love, yeah.
All right,
Fine.
Michael. Take care.
Pop my nose in and look at you tomorrow, all right?
Tomorrow.
10 to 9 is your appointment, yeah.
Okay, love. Thank you.
All right. Take care, okay?
All right, love, yeah.
What's the matter today then?
I've had had a lump down below.
Yes.
I thought it was nothing. It hasn't gone away, but there's another one that's appeared. I don't think it's anything sinister, but I just wanted to
Sure.
check it out.
So how long has it been going on for?
A couple of months.
Painful at all?
No, no pain.
Discharging,
no,
anything like
no,
that?
nothing.
Should we have a little look?
Yeah.
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 Do you want to come and
Yeah.
sit sort of down below in the vagina area?
Yes.
Or more in... So whereabouts?
So it's just sort of inside.
On the right side?
Yeah.
Or... Is it this bit? Oh, just here?
Yeah.
Okay, that's fine. Okay, hop off again then.
Okay. Right.
Fine. So you're right, it isn't anything sinister. So you can breathe a sigh of relief. It's a cyst.
And we have some glands down there that are called Bartholin's glands. We all have them, and sometimes we get cysts in them, and that's what it is.
Right.
Won't do you any harm at all. Sometimes they can get infected, but it doesn't look infected at the moment.
Brilliant.
So
okay.
nothing you need to do about it.
Yeah.
But if it did start getting much more swollen and painful, that might be a sign it was infected, and then we would need to see you.
Lovely. That's great. You put my
Okay.
mind at rest, yeah.
Yeah.
Lovely. Thank you very much.
That's all right.
Thank you.
Okay.
Bye.
Bye-bye then.
Come on in. You have a seat here. You're the patient today. Okay. Right. How can I help?
He's got sore throat, bad chest, to
Right.
the point where he's not eating. He's at ice cream and a bit of pasta in the last 2 days, which ain't like him.
Yeah.
He was up till 2 o'clock this morning, sat on the sofa, shaking his legs, shivering, even
Right.
though he's not cold.
Yeah.
I checked his temperature was fine.
Yeah. Have you got a blocked nose as well? No. Earache? So it's the sore throat and the cough, mainly. Should we take your temperature?
I just wondered whether or not Eve had the same thing.
Yeah, it's
So
possible,
my
isn't it?
grandson's been ill as well with it, so...
So 37.5, so not really too dramatic. And let's just take your pulse next. That's normal. And let's have a look in your mouth. So if you open up really wide. You say, oh? Oh. Yeah, they're huge, your tonsils, okay? And they are quite pussy. And I'm just going to have a feel under here, okay?
As I say, he's never ever ill, never.
So with a sore throat, you can have 2 different infections causing a sore throat, a viral infection or a bacterial infection. So the bacterial infections are the ones that get better quicker with antibiotics, and the viral ones are the ones that don't get better with antibiotics. There's some criteria that we've developed that help us work out if you will get better quicker with antibiotics or not. And it's a scoring system. So the first thing is that you need to have a temperature, and you've got a very slight temperature, but it's really not that high.
Yeah.
And you've said you've taken it, and it hasn't been very high, so I don't think you get a point for
I was
that.
going to say, no, it hasn't been anything over 37, so...
You get a point for having pus on your tonsils, and you do have some white bits on your tonsils, so you get 1 point for that, okay? You get a point for not having a cough, and you do have a cough, so you get no points for that, so you're still at 1, yep. And then you get a point for having really tender glands in your neck. And you don't really have very tender glands in your neck. So my feeling is that this is most likely to be viral, okay? So you'll get better on your own. And the important thing is to drink plenty, because if you don't drink enough, then you feel more unwell because you get dry. How does that sound? Is that all right? And I think we should see you again if you're more unwell, but I would hope that you've probably had the worst of it and that you'd start feeling better over the next few days. Good.
Right, there you go.
All right.
Come on.
Oh. Right, so come in. Now, this is Leslie Black, who's our new doc.
Hello.
Come and have a seat here. No, I'll sit here.
Right, there we know where we are.
So that's where we are. So...
I had a thrombosis in this leg. Well, the same pain has come back. I thought I'd better get it checked out, simple as that. Because they're nasty.
How long ago did you have the one before?
1 year, 1.5, something like that.
Okay. And you took some blood clotting warfarin probably or something for 3 months,
so
did you?
injections every day. Sorry, 6
right.
months. But it's not in one place. It's all up my leg just feels aching.
When did it start?
2 weeks ago.
Anything make it worse?
Long walks.
Okay.
Don't do long walks, I know.
And when you do a long walk, what do you get?
Aching. It's aching now.
So the other question I would have would really be about your circulation.
You know, I'm a diabetic.
Yes.
And my feet are numb quite a bit.
Okay. Okay, let's have a look over here, if that's all right.
Do you want my...
Can you pull it up? Pull the trousers up. So this is a good start. I'm just going to my room to get the tape measure.
That's no problem. Learning, are we?
Yes, yeah, I just started yesterday.
Hey.
I'm not very good with the computer.
Neither am I. I'm computer illiterate, actually. I can crash a computer by switching it on.
So when you had a thrombosis before,
Yeah.
I expect you had a swollen calf.
The doctor I spotted it straight away. There was no bumps or lumps or whatever.
Yes, so that's 237. I'm just measuring the size of your calf to see if it's much different. And it's about the same, in fact. This one's a little bit smaller. I'm just going to feel the pulses in your feet to make sure your circulation's all right, though because of your diabetes, this may have gone a long time ago.
No, they said you've got quite good feet for your age. I thought, thank you.
What is your age?
71.
OK, well, that looks fine. And the good news is I don't think it's anything worrying, but the bad news is I can't tell you exactly what it is.
Thank you.
I think if this grumbles on and on, we can see it again. But at the moment, it's a bit of an ache there. Nothing there to find, so wait and see what happens. Almost certainly, you know how aches come and they go. Is that all right?
Yeah, that's
But
fine.
you don't need to worry. We don't need to whiz you up to Southmead for the DVT thing.
I'm glad about that. Thank you very much.
That's a pleasure. Nice to see you.
Have a nice day.
Hello, have a seat.
Thank you.
I'm Dr. Juel.
I know.
Do you?
Yes, I
Oh
do.
dear, have I seen you before?
Oh, a long, long time ago.
Was I any good?
Maybe.
You've forgotten. It's great. That's really... No, it's great. If you, oh, look, there we are. Not that long ago, April 2015.
Well, that's still a while ago. We're in 17 now.
You were feeling tired.
Oh, my goodness, yeah.
You still tired?
At the moment, I'm just...
Why is that? Is that why you've come today?
Yeah, I'm totally exhausted. I've been exhausted, proper exhausted, about 3 weeks, but that is going along with being sick and feeling sick all the time, constantly.
Now, you eat and you feel sick straight away?
Yeah.
OK.
Yeah, I feel sick even before I eat, but I know I have to eat, so I do try.
And do you get any pain?
Not pain, it's just this awful feeling of just wanting to vomit straight away. And I have vomited.
I want to feel your belly. Just
Yeah.
pop yourself on the bed if you don't mind. I'm just feeling around to see if I can feel any lumps or if I
That's
feel
uncomfortable, that side.
OK.
But not painful.
Big breath in. And out.
That makes me feel sick.
And again. And out. That's right. OK, that's fine. I'm not going to do anything else. Come sit down.
Now I feel sick. Ugh.
I'm going to label this as being dyspepsia, meaning indigestion, all right?
OK.
And the reason I'm going to label it like that
Sorry.
is the way you describe the timing of it. That it happens instantly, OK, after you've eaten. So that's why I think the absence of pain is a little unusual, but it doesn't bother me enormously. All right?
OK.
Does it ever wake you up?
The sickness feeling does,
Yes.
yeah.
OK.
I thought you retired anyway. Did you not retire?
Yes.
OK. You love it that much, you've come back.
I decided retirement's a very bad idea.
It keeps you going, doesn't it?
Yes, I think the problem about this is I keep thinking I'm enjoying this too much. This is becoming rather self-indulgent. And actually, if you're not careful, you just go on and on and on. There was a famous chap that we knew who had grown up, I think, in Czechoslovakia and was Jewish and had to come here and came here before the war as a refugee.
OK.
As a doctor. He went on working until his 80s or 90s or something. You think, well, So I'm not going to do that.
We'll see.
I'm now going to give you anti-sickness thing, and you take that 3 times a day.
OK.
Now, you go on taking the metoclopramide until the vomiting stops,
OK.
and then you stop
Stop
them.
it. OK.
The omeprazole I've given you for a month, and you should certainly, and if it's working, you should certainly take it for a month. Now, if this does not work, then we would be a little concerned, and we would probably want you to have an endoscopy.
OK. Lovely. Thank you very much, and I will see you when you're 85.
What a thought. Ghastly thought.
Thank you, Dr. Juel.
Bye-bye.
Thank you very much.
Come and have a seat.
OK. Well, we haven't met.
No, hi, I'm Dr. Ramshaw. Right, what can I do for you?
I don't know.
Oh, right, OK.
I phoned up the treatment room.
Right.
And they just said, come down.
So I think it's booked down for a medication review. So how are you doing?
My cholesterol usually used to be high.
Right.
When I used to come down.
Yeah.
Because it was more or less on my birthday.
Right.
Which is no good to me at all, is it?
It doesn't have to be on your birthday, it's around your birthday month.
Yeah.
So...
Well, I got to be within a good couple of weeks away from ready to be properly.
Yep, that's fine.
But it was always that little bit too high.
Yep, okay.
But that's
right. Okay.
I'm not going to go without everything. It's not my birthday.
No. You're on cholesterol tablets, blood pressure tablet, aspirin. Okay.
Yeah.
So what we need to do is just arrange for you to have a blood test done. Okay.
Is that going to be now, or have I got to come back?
You've got to book an appointment, unfortunately.
This is what... Now, that's annoying to me,
Yeah,
see,
no,
because
I can
that's what I
understand
phoned
that.
up, and I said I always have blood tests and that.
Let me do it for you now, then.
Because I don't want to come back, because otherwise I've
I'm
got to
offering to
try
do
and
it
work
for-
it. Yeah.
Yeah, okay.
Otherwise I've got to work it round...
Let me do it for you now. So what we'll do from now on, after today, it should be one trip. I totally agree.
No.
All right.
Might be a bit of alcohol in there at the moment.
Why is that?
I'd like a drink.
How much are you drinking?
Oh, Skittles, that's got to be 4 pints.
And how many times a week do you do Skittles?
I only do that once.
Okay, so what
But
about the
then
rest of the week?
Well, I do like have a drink. I know when to stop, see, because it tells me
What tells you?
to drink.
Right, okay.
Go over the top, you suffer.
Yep, that's very true. Do you need a plaster? There we go.
Right.
Have you got all your medication?
Yeah,
Yeah.
not long ago.
Fine. Okay?
Okay,
All
no
done?
problem. Look it out.
Okay.
There's nothing else.
That's it.
You didn't want me weight or anything?
No.
I'll tell you, it's 11 and a half, and I'm that high.
You're not overweight.
I know I'm not that
Yeah.
high.
Okay,
All right,
bye-bye.
Thanks a lot. Cheers.
Come on in, have a seat.
Thank you.
Okay.
Oh, everything's been happening
Yeah.
for the last month. Angela's not been at their best
No.
with the chest infection and the water infection, which culminated in her having to go back to hospital because she had a fall.
Yes, I saw. Is she in hospital now?
She is,
She is, right. Don is the full-time carer for his partner, who sadly had a brain hemorrhage in 2010. Before that, she was perfectly well, and obviously this has been devastating for them both.
I mean, I would say come home straight away, but I wanted a social worker involved to help me because I'm tired.
Yes. He has been looking after her 24/7 with the help of some paid carers. She is physically fairly well, but unfortunately has quite a lot of cognitive impairment.
I feel run down.
Yes.
I don't know if it's my tooth, I don't know if it's an infection I got.
Yeah.
Or...
If you open up wide, you've got quite a big swelling. I think you have got a dental infection in there, okay? So I think you need to go to the dentist. So do you know where you would find a dentist?
Yep.
Yeah? I'm just wondering whether we struggle to get you in to manage your health issues because of your responsibilities looking after your wife, okay? So I am a bit worried about you and your health. I think you're going to need a break, aren't you?
I need some help, just some help. Really.
Yeah.
'Cause I can't leave her for 1 minute.
No.
But I do need some help.
Yeah.
Specifically culminating in doing something with my bathroom because,
Yeah.
I mean, anything that would help us, like a wet room or something like that,
Yeah.
would help her greatly.
Okay.
I'm hoping when I speak to the social worker that
Yeah.
they can at least push for a toilet downstairs because
Yeah.
most of the things that really goes wrong,
Yeah, it's all around toileting and washing.
yeah.
Yeah. Okay, maybe I should do a referral too to occupational therapy, okay?
Yeah.
Getting a toilet that she likes is quite important, actually, isn't it? When she comes out,
Yes.
maybe we should arrange for her to have a community nurse come in and just do a bit of an assessment, maybe
Absolutely.
around the waterworks issue,
Yeah.
particularly. You might want to think about
Yeah.
her having even more help, either at home or going into a home for a few days or a week, just every few months or so that you can have a break and you can look after yourself.
That sounds pretty... I know where you're coming from.
Don has very little time for his own health and has a number of health issues that we find it difficult to get him in to talk about. He has physical health problems, but he also is getting quite depressed and stressed now because the care responsibilities are so huge. People who are full-time carers ideally need to make some time for their own health. This is very difficult, and we as a society struggle to support people who are carers.
You've been together nearly 30 years now.
I know. Well, you're very close and you've been fantastic looking after her. And really what I want is for that to be possible for many years to come. You've been soldiering on now for ages, and it's really hard, you know?
I just got to I just don't give up. I've got
No.
to never say die attitude.
Yeah.
It's just soldier on, you know.
Yes.
I make mistakes just like any other people do, but
Yeah.
I try my best to learn from them.
Yeah.
It's not always down. I mean, we have some tremendous time.
Yes. OK, so you just let me know, all right? And you get your teeth sorted, yeah?
Okay, I'll try to
By
get
the
that straight away.
experts, OK?
Okay,
All
thanks,
right.
Doc. I'm glad I had to speak with you anyway.
That's all right, yeah. I think it was
Necessary.
the right time for that, wasn't it?
Yeah,
All right.
absolutely.
OK, bye
Thank you,
now.
Doctor.